Hi, everybody. My name is Tessa. I'm with Fertility Specialists of Texas. Thank you so much for joining us on this amazing Friday. We're going to be talking all things endometriosis with Dr. Barbara Stegman.
Hi.
And before we get started, we just want to say Happy National Compliment Day and that you are all amazing and fabulous. And we are so happy to be talking to you. So let's just kind of get started. I don't know if everybody knows, but more than 200 million women across the world are afflicted with endometriosis. Many are, it's kind of an estimated because there are a lot of undiagnosed cases because it can be kind of difficult to diagnose, which Dr. Stegman will get into in just a minute. But more specifically, for those of us in the United States, 1 in 10 of us are actually impacted by endometriosis, and I am one of those who have lived to tell the tale of the very painful condition. So if you have any questions, please feel free to post in the comment section and during this live. And then afterwards, Dr. Stegman, I can contact her and she can answer any questions that you may have as well. So just like the first question, we're answering most frequently asked questions. What are the first signs of endometriosis?
Well, in general, most people have pain. That does not mean that you have to have had a period to have your pain, because young girls prior to periods can actually have debilitating pain. But the most common symptom we see is debilitating pain, usually with the period, although it can be at any time of the month, and does not have to be related to anything.
Okay. That was something that I struggled with. I had awful cycles, but also after I had my first son, my endometriosis pain, it was debilitating pelvic pain. And it wasn't uncommon for me to shut my office door and lay on the floor, like flat on the stomach, to just get any kind of relief. It was a miserable, miserable way to live. And there wasn't really any relief. And it was just awful.
Well, and it's really awful when they're young girls and they're 10 years old. They're 2 years from starting periods.
Right.
And they are just crying in a ball on the floor because the pain is that bad. Not everyone has pain.
Right.
So endometriosis, you can have horrible pain and have very little disease when we look at the pelvis.
Right.
Or you can have horrible disease and have very little pain. Right. So it's a very strange disease.
Yes, it is. So you kind of touched on it a little bit, but what happens when you have endometriosis?
Endometriosis is classically described as the lining of the uterus being implanted outside. So either on the tubes or on the ovaries or on the pelvic wall. And when you have a period, that area will bleed. It responds exactly the same as the lining, the inside, but it doesn't have anywhere to take that blood. So the blood, it just irritates everything around it. And there's lots of other chemicals and things that are released at the same time.
Gotcha. So it's been said there are 4 stages of endometriosis.
There are 4 stages, and it depends on the seriousness of the disease. So stage 1 and stage 2 are judgment calls. You look at it and you say, not so much, or this is a little bit more, so I'll call it stage 2. When you get to stage 3 and stage 4, stage 3 is generally ovarian involvement. Mm-hmm. So if you have what we call an endometrioma or chocolate cyst, which is a big cyst on the ovary, that will make you stage 3. And the stage 4 is what they call a frozen pelvis, where everything is just kind of sucked in.
Yeah, I was lucky enough to have stage 4.
Yeah.
And I would go in for what I called my spring cleaning, my fall cleaning, and they would go in and clean out all of these spider webs because everything was glued together almost and not where it should be. And they were like, wow, you really make some awesome cobwebs in there. So how is endometriosis diagnosed?
The diagnosis is actually made in surgery. You can't really make the diagnosis with a test. And the Endometriosis Association, which is in Milwaukee, which is a very good grassroots organization, has been looking for years for a test. Yeah. And there's not really a way to diagnose it other than going in and actually looking at the tissue and biopsying it.
So what would make a physician decide, okay, I really think this is a no, I think we need to go in and do surgery? And what kind of surgery is that?
Well, things have changed. So in the past, anytime anyone had pelvic pain, we would just put a scope in and see what was going on. The reality is that what we found is that doesn't do much for the disease anymore. So most of the time you treat endometriosis, what we call empirically. So if you come in with terrible pain and terrible periods, the best way to treat that is to not let you have a period again.
Right.
And so we'll put you on some kind of birth control that prevents you from bleeding. The odd thing, the good thing about that is the progesterone in those pills is also a treatment for endometriosis. High doses of progesterone will help the pain quite a bit. And you don't want big fluctuations in your estrogen levels. Estrogen makes the pain worse. So
that kind of leads into the next question, because most people who are fans of our page are actively trying to conceive. You're on
unfortunately, and this is the bad thing about endometriosis, if you're trying to get pregnant, you can't get treated for the pain. So you treat one or the other. So my way of approaching that is you're going to stay suppressed and you're going to stay on whatever's working for your pain until the time you are ready to get pregnant. And I personally don't like to do a lot of IUI cycles on people who have bad endometriosis, because it just hurts. It's very uncomfortable. Yeah. Let's go in, let's do an IVF cycle, let's get those eggs out, let's make those embryos and do the implant. And as soon as you're pregnant, or as soon as you're not pregnant anymore, we put you right back on your suppression.
Gotcha.
I just don't think it's a good idea to have a lot of women menstruating when they have bad endometriosis.
Does endometriosis impact implantation?
Not implantation. So it's all outside of the uterus. So it's not going to cause you not to be able to implant. It may cause you not to be able to release an egg that can get to the sperm and the egg to get together. It may prevent the egg from coming through the tube. It may be that the chemicals that are being released into the pelvic cavity are poisonous to the egg or the sperm, and that's what's preventing you from getting pregnant. But once you've got the embryo and you're into the tube, you no longer really have any problems. So if you implant an embryo, you have very good pregnancy rates, because that's not where your problem is.
So does it impact egg quality at all?
Not egg quality. It can impact egg quantity. That's one of the reasons I don't particularly like to do a lot of surgeries anymore. If people have a tendency to want to take the cysts off of the ovaries, and every time you do that, you're pulling eggs out, or you're destroying eggs. So I just don't like to go in and touch the ovaries, but it's going to destroy part of the ovary, so it can have an impact.
Does it, once you're pregnant, you kind of touched on this, but one of the questions that we get asked a lot is, does it cause a greater chance of an ectopic pregnancy?
No, not necessarily an ectopic pregnancy. The chances are about the same unless you have tubal disease. They're about the same. Most women who have tubal disease related to endometriosis are having trouble getting pregnant. Right. So it's not really the endometriosis, it's the damage from the endometriosis that's causing the problem.
Just a couple more questions. You're actually very fast today.
Oh, goodness.
I love it. Short and succinct. Can it cause miscarriage?
No, endometriosis generally doesn't cause a miscarriage. Miscarriage is pretty common. So people who have been struggling to get pregnant tend to be older. Endometriosis generally isn't diagnosed until about 32 years of age. Okay. That's the average age of diagnosis, and most women have seen 7 physicians on average before they get diagnosed. So it's a very difficult thing to diagnose. But you're 32, you're 33, you're trying to get pregnant, you can't get pregnant, and if you have a miscarriage, people want to make that because it's endometriosis, and it's not.
Is there any cure?
There is not. There are no cures for the disease. There are treatments for the disease. And they have tried a lot of surgical procedures. They are pretty dramatic, pretty drastic surgical procedures. Lots of women have their ovaries and uterus taken out. That does cure the pain in a lot of cases, but it can still be there. It's still endometriosis.
Right. As in my case, my husband and I went through infertility treatments to have our son Cooper, and I always had a vision we would have he would be a big brother, and we would have a sibling for him. And we started treatments again, and every time I went in, there was another issue, and the pelvic pain was so debilitating. I was like, I'm not the mom I want to be. I'm not the wife. I'm not the employee. I cannot do this. And so I was one of those that took that drastic measure and had a complete hysterectomy. And they kind of always advocate it's not a cure. And I was one of those that afterwards, I went through a mourning period because you no longer feel like a woman.
Absolutely.
And I no longer have the opportunity to carry a child. And I actually woke up from my hysterectomy in the children's ward, and I started bawling. And I sent my mom and my husband out. I was like, get me off this floor immediately, because I was grieving so many different things. But anyway, but I was one of those who had pain afterwards, and I had to go to a couple of different doctors before they believed me.
Mm-hmm.
They're like, you don't have anything, you're fine. And it's not in my head. And so I finally found someone who went in and did a laparoscopy after, and they're like, oh, yeah, you still have some endometriosis.
Yeah.
And I had my final, I think it was in the spring, my final spring cleaning, and that, kind of helped. Everything was cleaned out and good to go.
Well, and that's very interesting is that people assume it's coming from the uterus, but you can get endometriosis implants in your brain.
Wow.
You can get them in your lungs. And we find these because people have seizures when they have a period, or their lung collapses when they have a period.
Right.
So there's no way for that to get from your uterus to your lung. Question is, how does it get there? And that's an answer we don't have yet.
Right.
But clearly, if it can grow in the uterus or in the lung or in the brain, it's not coming from the uterus, so it can still be there when your uterus is gone.
In terms of, for those who are kind of watching, how frequently do you see patients come in that are battling endometriosis or feel like they might be?
That's an interesting question. So we know that 10 to 15% of the population have it.
Mm-hmm.
In the infertility population, I would say probably a third. Some of them don't realize they have endometriosis.
Right.
Sometimes we don't find out until we're stimulating and we actually put needles into the ovary to get the eggs out, and we get chocolate. And
wow.
That's an endometrioma. So it's hard to know. I would say at least a third of women. And some people will say everybody who doesn't get pregnant has endometriosis. I think that's a little drastic, a little too much one way or the other. But
so you had mentioned earlier that you don't really recommend an IUI for someone who has endometriosis.
No, it's not that I don't recommend it. You can get pregnant with them, but it tends to take longer.
Okay.
And I have to stimulate your ovaries. I have to make your estrogen levels every month get high, and you have to have a period every month. Those things are not good for people who have endometriosis.
Right.
That's going to make life worse for you. So I try, if I do IVF, I don't have to do those things.
So is there anything else, we're going to kind of wrap up, is there anything else that, anyone who is struggling with infertility that, or might think they have endo or have been diagnosed, that any advice for them or anything that they can do on their own? Because everyone's kind of like, in the infertility world, as I'm sure you know, you feel powerless, and in some way you want to have control over something. Is there anything that you can do at home to kind of help in this realm?
To help with the pain or to help with the diagnosis? So I think the biggest thing is if you think you have pain that's unusual or out of proportion to what you think, and your doctor tells you you're crazy, don't listen and go to somebody else. Because, as I said, most women have seen an average of 7 physicians prior to getting the diagnosis. And they get the diagnosis at 32, but they're getting their symptoms much, much earlier than that. So be an advocate for yourself. Say, this is not normal pain. And you need to find somebody. And if you need to come to a reproductive endocrinologist, come to a reproductive. We are much more sensitive to it, I think, than a lot of general OBGYNs. The first couple of things that we do for people who are having endo pain, birth control pills, and Motrin or Advil. And a lot of times that does help significantly with the pain. Now it helps with a lot of pain for a lot of things, but it does help with that pain. And so you can try those things at home. But if you're taking more than the recommended amount of an Advil pill, and I have had people who will take 30 pills a day to try, that's too much. Don't do that. Go and find someone who can help you. And there are some new drugs out now. There's a brand new one out that AbbVie just put out in the last couple of years called Orlissa, and they've had some very good results with that. But there are things we can do to treat the pain. And so don't just assume that you're going to have to deal with it. We can work towards making you feel better. And there's a lot of things about endometriosis that we don't understand as well. One of them is people have to usually have bowel symptoms, or not bowel symptoms, bladder symptoms.
Mm-hmm.
Irritable bladder tends to be very closely related. So sometimes you need to treat those symptoms as well.
All right, guys, we are going to say goodbye. Again, it is National Compliment Day, and don't forget that you're amazing. And we hope you have an amazing Friday. Again, if you have any questions for Dr. Stegman or any of our physicians, please comment below, or you can send a message through our Facebook Messenger, and we will get those questions answered for you. We hope you have a wonderful weekend. Talk to you soon.
Bye-bye.